The injury I will be doing is plantar fasciitis. I will now palpate the three bony landmarks that correlate with the injury, starting with the medial malleolus. To locate the medial malleolus, you first have to find the bone that protrudes on the inner side of the ankle. Right here, I have that marked. It's at the end of the tibia. To locate the navicular, you must go about 2 centimeters anterior and inferior of the medial malleolus, which is right around here. Now I will locate the sesamoid bone. The easiest way to locate the sesamoid bone is by dorsiflexing the toes and going under the base of the big toe. I will now begin on the 3 soft tissue palpations that correlate with the injury, starting with the Achilles tendon. To locate the Achilles tendon, it's a band of tissue at the back of your ankle and above your heel. It's the strongest tendon in your body and allows for plantar flexion and motions like walking, running, and jumping. I will now start my next soft tissue palpation, beginning with the posterior tibialis. To locate the posterior tibialis, you need to invert the foot and follow the tendon that wraps around the medial malleolus. The next soft tissue palpation I'll be discussing is the plantar fascia. To locate the plantar fascia, you must go beneath the foot of the skin, and it's a thin ligament that connects the bottom of the heel to the front of your toes. An acute treatment for the injury, I will use a water bottle and put it between the arch of the foot and have them roll it out to relieve some stress. An acute treatment I will also use is orthotics. I'll have the client wear them during the day to relieve irritation and pain. For long-term treatment, a point of emphasis is increasing flexibility of the calf muscles is particularly important. Frequently used stretching techniques include wall stretches and curb stretches and stair stretches. Another long-term treatment plan for plantar fasciitis is PRP injections. I will be discussing the knee joint inflection. First, I'll be starting off with our soft tissue palpation, which is the patella tendon, which is this rope-like structure. And if you go directly below it, we'll be locating our first bony landmark, which will be the tibial tuberosity, which is this bone-like structure. Next, I'll be going laterally of the knee and locating the head of the fibula, which is also a bone-like structure. I will now be focusing on the hip joint, and 2 bony landmarks we'll be locating will be the ASIS, which will be right here towards the front, and a little bit towards the back, you'll be seeing the PSIS. And if you go towards the front again, a little bit inferior, you'll be seeing the tensor fascia lata, which will be our soft tissue palpation.